So what happens? What happens when a country in its public health policy, what does a non-politicized public health policy look like? When we don't follow flat earth junk science, but the actual science, what does it look like? What happens when a country has no other agenda other than what's the truth? What's the best approach for the millions of people that have entrusted their health care to us? Not whatever any other agenda is on the table. I want to show you what it looks like. In lieu of a vaccine that can induce it, you pursue natural herd immunity, as humanity has had to do for thousands of years, before and without vaccines. That means that a country would recognize that there are forces at work in this world, in nature, that are beyond us. That as a species, we must do our best to continue on while acknowledging that. The perfect utopian solution, not always possible. Some evils we simply and sadly have to live with, and we can't make the perfect the enemy of the good. So such a country would do their best to secure the most vulnerable as best they can, and let those the data shows weren't nearly as vulnerable out to live their lives. And yes, that would also mean taking the risk that they would contract this virus, because you want them to. They would help you to weaken it by putting the virus and pitting the virus up against their superior immune systems. This is what we've done as a species for thousands of years. Now, that would also mean, though, that such a nation would suffer an initial peak of cases and deaths that other nations which went into lockdown may not. But they would be much better off on the back end. They would truly flatten the curve. And once they did, it would stay flattened. Such a nation exists. Its name is Sweden. On June 24th, Sweden reported 1,800 cases of coronavirus. Yesterday, it reported just 125. 3 of the last 4 days, it has reported fewer than 200. It has reported more than 500 new cases in a nation of 10 million only one time since July the 4th. Sweden reported a peak of 115 deaths on April 5th. It hasn't had more than 80 deaths since April the 24th. It hasn't had more than 60 deaths since May 18th. It hasn't had more than 40 deaths since June 4th. Do you notice a pattern here? It hasn't had more than 30 deaths since June 17th. It hasn't had more than 20 deaths since June 28th. It has only had 96 total deaths so far in July, with 14 being its worst day so far this month. 3 of the past 4 days, Sweden has had 1 or 0 deaths. And by the way, Sweden is coding deaths exactly as we are. If you die with the virus, you are being coded as having died from the virus. So even with those exact same coding metrics we're using, these are their numbers. Now let's bring it back home here and contrast Sweden with my former home state of Michigan, each with roughly 10 million people, the same population. Michigan has added 12,108 cases in the last 30 days since it began reopening, despite having one of the most restrictive and longest lockdowns in the country all spring. Remember, Michigan was the state where you couldn't go and buy seed to plant a garden during their lockdown. Yesterday, Michigan added 1,049 new cases, its largest day of new cases since May the 14th, which is, by the way, when it was in lockdown. It was spiking new cases. Michigan's last day of cases this high was May 14th, when it was still in a lockdown. I thought lockdowns worked. Michigan has added 500 new cases 6 days already in July. Thankfully, Other than July 7th and 11th, though, when it reported a combined 58 deaths, the mortality in Michigan has remained very low. But that is likely because the younger, healthier people are being allowed back out again. So the virus, as it did in Sweden, is now competing and coming up against stronger immune systems. Plus, it is much warmer in Michigan right now than summer typically is in Sweden, too. Therefore, the absolute worst decision the governor of Michigan, Governor Whitmer, could make is to reinstall a lockdown. If deaths stay as low as they are now, while cases increase, Michigan can accomplish this summer what Sweden already did: natural herd immunity. What America would have also likely already had if we had not instituted mass lockdowns. The absolute dumbest management decision based on flat earth, junk science, and human history? Show me one dumber.